Every 3 minutes, a child is born with a cleft lip or palate. It is the third most common birth defect in the world. Developed nations with good healthcare systems typically repair cleft lips within 3 months of birth. But in poorer or undeveloped countries, these children fare far worse. 1 in 10 die before they turn age 1. Those that survive may have difficulty talking, making friends, or even smiling. Internationally and domestically, plastic and reconstructive surgeons are committed to helping these children. In the June issue of the Journal of Plastic and Reconstructive Surgery, we explore 3 different studies that discuss the impact of this deformity and the most recent surgical advances to treat cleft lip and palate children all over the world. In our first study, the authors review the outcomes of cleft palate repairs in children who are born in a foreign country and are adopted by American parents. We get an in-depth look at how age, pre-adoption environment, surgery, and learning to speak English influence the speech development of these children. The authors find that the older the child is at the time of the palatoplasty or the cleft palate repair surgery, the higher the chance that a secondary or another operation is needed to improve speech. This is not surprising. The authors suggest that there needs to be an assessment of the speech, intense speech therapy, and surgical intervention as soon as possible after the adoptions take place in order to help the child grow, recover, and thrive in their new environment. In our second featured PRS article, we get an in-depth review of how cleft palates can affect a child's speech.
Pull the baby buggy.
Give Kate cake.
Give Kate the cake.
Sissy sees the sky.
Sissy sees the sky.
Jim and Charlie chew gum.
Jim and Charlie chew gum.
This is called velopharyngeal dysfunction. When cleft palate children, speech is hindered because the nose can't close off from the mouth from the soft palate. This is a long-lasting concern for cleft children and their speech development. As part of an ongoing study, the authors in their final article investigate the quality of life of 1,200 American school-age children with clefts as judged by factors including oral symptoms, functional well-being, social and emotional well-being, schooling success, and self-esteem. Independently of these results, the surgeons determined the severity of the children's defects. As expected, the kids who had more severe cleft palates had reported a lower quality of life than their peers with less severe cases. Interestingly, girls expressed a worse sense of well-being than boys. The authors plan to do further research to discover if cleft palate repair surgery improves these children's quality of life by adolescence. With over 2,000 children born with cleft lip and palates every year, studies like this take on an even more importance in plastic and reconstructive surgery, because we as plastic surgeons can help them both nationally and internationally. And so with studies like these, through charitable work and our everyday practices of plastic surgery, we do and we can help advance the art and science of cleft palate repair and help these children regain their voices, their lives, and their smiles, which is truly one of the most amazing and awesome elements of what we do every day as plastic and reconstructive surgeons.